Now we're going to see bronchiectasis. Bronchiectasis is part of the COPD diseases of the lungs. This is chronic obstructive pulmonary disease, and we have an obstructive pattern. This is FEV1, forced expiratory volume in 1 second, divided by forced vital capacity is less than 80% or 70%. Alright. In bronchiectasis, we have permanent dilation of the airways, and losing of the tone of the smooth muscle that is surrounding the bronchioles, the primary bronchi. Less tone. This results in signet ring sign, that is, the airway. The diameter of the airway is greater than the diameter of the vessel that is nearby. We also have the arteries and veins are dilated, tortuous, fragile, but the airways are more dilated. Yet we have the neovascularization, and this can go to hemoptysis if they rupture. Usually the rupture of this new anastomosis that we are doing is in the low pressure airways. This is the bronchioles. If the bleeding comes from high pressure airways, like the trachea or the bronchi, this could be life-threatening hemorrhage, but usually it's not. Alright. Other thing is the causes. Could be many causes. Could be because of obstruction. Obstruction, the most common cause is by a tumor, but also could be localized foreign body. Usually this is just a bronchiectasis that is localized, not diffuse, like in other syndromes that we are going to see. Obstruction, infection. Infection usually is Staphylococcus aureus or Pseudomonas aeruginosa. Sometimes Haemophilus influenza, and Burgdorferia cepaceae, just in cases of FQ, fibrosis cystica, cystic fibrosis. In cystic fibrosis, we have a deletion in the 508 amino acid of the protein that is chloride channel. We'll see it in the biochem videos. The important here is that we have bronchiectasis, and the mucus that these children produce is very dehydrated, and so the mucus obstructs and can produce the bronchiectasis. These bronchiectasis usually are diffuse in all the lungs, besides in comparison to the obstruction, which is just in that specific part. This is localized, this is diffused. The most common cause of bronchiectasis in the United States is cystic fibrosis. In other countries is tuberculosis. Alright. Treatment is just bronchodilations, like in asthma,